Okay, hello everyone. I'm Julia Macher and welcome to today's webinar, Emerging Trafficking Trends in the Era of COVID-19. This is an event organized by Freedom Collaborative and the USAID Asia CTIP project. And we are very pleased to continue our joint webinar sessions. I'm also really happy that so many of you joined today, even though we know it's really a lot going on in the world this week. So we're really pleased to see so many of you taking the time. Before we get started, I would like to go over just how to participate in today's event. A few of you are already busy introducing yourselves. You can do so in the chat and mention your organization and also where you're currently based. And then you also have the opportunity to submit questions to today's presenters by typing your question in the Q&A window, which is at the bottom of the control panel. You may send in your questions at any time during the presentations, and we will collect all the questions and address them once all the panelists have presented. Okay, so I see everybody's typing already. This is great. I won't waste any more of our precious presentation time, and so I will now like to introduce our first presenters, Michael and Tuong from Blue Dragon Children's Foundation in Vietnam. Michael and Tuong, maybe could you start by giving a brief overview of Blue Dragon and then directly go into your presentation. So the floor is yours.
Sure, happy to. Thank you. And thanks everybody for joining us. So Luong and I are in separate locations, but both in Vietnam. I'm speaking to you from Hanoi, and Luong is up in the northern mountains of Ha Giang. We work in Vietnam with children who are homeless on the streets of Hanoi, and also with victims of human trafficking. So we've been doing this work since 2005 was our first involvement in human trafficking. And what I'll do now is I'll speak briefly about the normal general work that we do on this issue, and Luong will speak more specifically about how COVID has impacted the trafficking situation here. Even though COVID has been well controlled in Vietnam, there have still been very significant impacts for the country. So Blue Dragon does quite a broad range of work on human trafficking. We work at both the individual level and the policy level with the government. Our work begins with rescue. So we receive calls for help from people who are in trafficking situations and find ways to get them out of that. Now, when we began our work, and I'll just show a couple of photos to give you an indication of what we do. But when Blue Dragon began our anti-trafficking work, we were initially with dealing with the issue of domestic trafficking, where children were being trafficked within Vietnam into sweatshops. And that's an issue that has come quite well under control over the years. And so it's been 3 years now since we've had to do a rescue of a child trafficked into a sweatshop. But this was the sort of typical situation where there were children in small, often household-based sweatshops, and we would go and find them at the parents' request, take those children home, and then work in the communities to educate families. And in that way stamp it out longer term. And while we were doing that work, we came across the issue of the trafficking, mostly of girls and women, but sometimes boys and men, into China, and mostly for the sex trade. So the photograph that I'm sharing there is a photograph post-rescue, where we're bringing a group of trafficked girls home across the border. So we receive calls for help from girls who might be either in forced marriages or in brothels. And those calls will come via their family. We don't operate a hotline. We'll go into China or have people who will go to the location where the girl or the woman is, help them to escape. So it's a non-combative rescue where we're not kicking down doors or anything like that, but we're helping people to escape. And we get them back to the border, where we report first to the Chinese police and then to the Vietnamese police. We're just coming up now to our 1000th rescue very soon. So it's obviously been very impactful at a human level, And at a more systemic level, we work with the government on law reform initiatives. So, for example, in this coming year, the Vietnamese government will be reviewing the national law on trafficking, and Blue Dragon will participate in that review. And we've also participated in other law reform initiatives. So we do that work on the individual level, where we're getting people home, we're providing shelter, family reunion, then assistance with psychology and legal advocacy, and placement in university or school or jobs and training, and then taking our knowledge up to the government level. Now that's the overview of what Blue Dragon has been doing, and I'll hand over to Luong to explain how that has been impacted by COVID.
Yeah, thanks, Michael. So I'm Luong, the anti-trafficking coordinator at Blue Dragon Children's Foundation. I am part of our legal team who conduct the rescue work and a lot of other anti-trafficking activities. So the government of Vietnam has been extremely effective in controlling the COVID-19 pandemic and minimize side impacts of the crisis. However, as an organization who directly rescue victims and assist them in reintegration process, Blue Dragon experienced immediate difficulties. So first of all, travel restrictions made the rescue work more difficult than ever. But at the same time, we also received many calls for rescue as victims experienced increased physical and sexual violence by their traffickers or forced husbands. So there is time our rescue team keeps in touch with more than 30 cases. The crisis also affected badly to the integration process of survivors. They lost their income. Those who graduated from vocational training courses could not find a job. So many of them are at high risk of being re-trafficked. And the social distancing order was applied in Vietnam in April. At that time, Blue Dragon analyzed what changes of human trafficking would be. And unfortunately, in the coming months, we has been experiencing all of them. Firstly, the vulnerability increases among existing victims, vulnerable groups, and those who were previously less vulnerable to human trafficking. School closures and children aged just 13 to 15 in mountainous areas left their house to look for jobs on streets or tries to cross the border. The number of early child marriages also increased among ethnic minority groups. People are spending more time on the internet, and traffickers also increasing targeting them online. The majority of new cases which Blue Dragon has received recently are trafficked by someone they met online. So the most affected people in this medical crisis are those who work in sector of hospitality, service, construction, and agriculture, where low-skilled workers and women are concentrated. They are more likely to be deceived. Just last week, Blue Dragon and Bodegas rescued 5 victims who were on the way being trafficked to China after traffickers promised them with jobs in Korea. So secondly, traffickers also find new ways to adapt to the new situation. We see an increase in domestic trafficking for labor and sex exploitation. From the beginning of the COVID-19 in February until now, Blue Dragon have rescued and received 21 victims of domestic trafficking, while in the whole years of 2019, we only worked with 2 cases. So there are also an increase in forms of trafficking, including organ removals, baby trafficking, and surrogacy in Vietnam. Facing these challenges, Blue Dragon sticks to our commitment of providing exceptional care for people in crisis. So we managed to keep the work as normal. We work closer with partners, develop relationships with new partners in new regions. So despite of the travel restrictions, the total numbers of victims we rescued and received in 2020 has increased by 70% to compare with 1990. And others, I think, is also a good opportunities for law reform discussions. Domestic trafficking is one of the weaknesses of Vietnam's law enforcement, as more than 90% of trafficking cases in Vietnam are cross-border. So therefore, we are reporting domestic sex trafficking to the police and promote for the trial. As Michael had just mentioned, that Blue Dragon is also working with the government to review the Vietnam's law on human trafficking prevention and combat. So we try to make sure that the laws will cover all new forms of trafficking and could provide the best support for victims. Yeah, that's a very brief introductions about the new trends and what we observed so far.
Thank you so much, Long. I think this was really interesting, and I hope there's going to be more questions for you guys because you're really on the ground and do have all this experience. And I think that's very, very good. You're actually working with the government and making sure the law can be adjusted to these new forms. I guess it's a challenge to respond, you know, as quickly as unfortunately traffickers are adjusting as well. Thank you so much for sharing all of this, though. And then we're gonna move on to Bangladesh now. So Piti, please can you also introduce yourself and then show your presentation?
Okay. Thank you. My sincere greetings to all who have heard this discussion, especially USAID Asia CTIP and Freedom Collaborative for organizing the webinar in the current topic. I am working in USAID funded Windrock International Bangladesh Counter Trafficking Person Program in Cox's Bazar district. Cox's Bazar locates on a coastal plain in the southeastern corner of Bangladesh. It has a fishing port, tourism center, and mostly Cox's Bazar is famous for its long sand beach. At present, in Cox's Bazar, 1 million Rohingya living, and they experienced a mass displacement to Bangladesh in response to escalating violence in Myanmar. This displacement has resulted in an estimated population of in Cox's Bazar. In Cox's Bazar, BCT program has organized both the Rohingya population and the host communities to discuss different issues relating to human trafficking, child marriage, and gender-based violence. And BCT program in Cox's Bazar is working in support to victims and at risk of child marriage, trafficking, and GBV. And we are designing the activities in 4 P's like prevention, protection, prosecution, and partnership. Through the 3 strategic entry points such as stakeholder engagement, media and awareness, and service quality. And implementing all these program activities of BCT is partnership through 3 local NGOs of Cox's Bazar. In my presentation, I will share the experience which we are facing to work in COVID-19 pandemic, especially in child marriage issues in the Cox's Bazar of Bangladesh. Actually, there is no specific survey or study conducted on trafficking in person and child marriage in the host community and Rohingya communities during March till October 2020, especially COVID-19 pandemic. But general understanding from a civil society organization, UN cluster programs, groups and international NGOs and local organizations, we can state that the trend of child marriage and incidents of human trafficking have been increased during the COVID-19 pandemic. According to UNHCR, the number of child protection related cases has increased significantly after the COVID-19 response started. And we have safe space-based support services for the child marriage victim, trafficking person victim, and at risk. So we are seeing that now from January to March, we have found 38 at risk of child at risk, where in April to June, it is going to 47. So we can assume that the sexual and gender-based violence and child marriage issues increasing day by day in the pandemic. And especially, child marriage continues to be a concern affecting adolescent girls and boys who are aged in 14 and 17 years. And we have found some causes why child marriage is increasing. And extensive unemployment, job loss, and lack of opportunity for income generation in the pandemic, it is increasing the child marriage issues in Cox's Bazar. Families are struggling. Families are struggling to meet the basic needs and consequently try to get rid of a feeding mouth by marrying of their young daughters. And parents think that the cost of marriage will be less in pandemic as they don't have to be invited others to the wedding due to avoid mass gathering. The people from both host communities and Rohingya are largely unaware of the consequences of child marriage and the nexus between human trafficking and child marriage. Due to lockdown, for COVID-19 and the closure of learning centers like child-friendly centers, girl-friendly centers, safe space, and other venues for children and women of government and non-government organization has resulting in further exposure of children to protection risks. The reduced numbers of protection staff in the Rohingya camps has opened up the avenue for community representative, which we are called in here in Majis, to play a greater role in mediating conflicts or violence. And oftentimes, they do not play a fair role, which is resulting in further abuse to the victims and causing child marriage and human trafficking also. During the pandemic, some refugees in Cox's Bazar have also expressed concern about their relocation to a chore from the camps by the government. It has made them desperate to move from the camp and find a better option for living, which is increasing the possibility of trafficking and child marriage also. And another thing is that returned migrants are spending leisure time at their home. So unmarried returned migrants are deciding this time to get married. Child marriage is a strong cultural phenomena among the Rohingya and also the host community of Cox's Bazar, and primarily rooted in socio-cultural and religious beliefs around willingness for marriage, and it is happening also in the COVID-19 pandemic. And another thing is that lack of social safety, especially for girls, as unrest situation is raising in the pandemic. BCT have taken some major intervention to address child marriage issues in Cox's Bazar during the COVID-19 pandemic period. And that is strengthening the capacity of communities. Under this, we are build capacity to a youth group, which are called in peer leaders, on-urban members who are trafficking survivors, and community leaders and who are also helped to identify child marriage victim and at risk in our in the Cox's Bazar. And another thing is that we are working in behavioral change communication and campaign, partners with a radio station and broadcasting public services announcement and outreach through door-to-door campaign. We are also increasing the responsive of duty bearers, train locally elected bodies, marriage registers, vow committee, and counter trafficking in committee members, partner staffs, and frontline law enforcement members. And last of all, we are working for improving access to assistance or services. At risk and victims are provided with shelter support, psychosocial counseling, and education program by the BCT program. In Cox's Bazar, during March to October 2020, we 204 child marriage victims and people at risk received counseling services through our safe space. 50 peer leaders, 32 ANIRMA members, and 20 members of youth group trained on child marriage issues, and 490 CTC members, 63 locally elected officials mobilized to prevent child marriage during the pandemic. And here we see at a glance to address same issues among Rohingya refugees and host communities and to prevent child marriage. We provide 500 vulnerable child marriage and at-risk victims to livelihood support so that they can coping with the under situation which is creating for the pandemic. 58 religious leaders is sensitized on child marriage and trafficking victim, trafficking issues. 164 counter trafficking committee members mobilized. 187 adolescent girls trained on safe migration, human trafficking, bad impacts of child marriage, and the nexus between human trafficking and child marriage. And 29,650 people of remote area have become aware on human trafficking, safe migration, and child marriage through the street drama. 750,000 audience have become aware through the community radio program in local dialect, both Rohingya and the host community. Bangladesh government have some initiative to reduce prevalence of child marriage, digitalization of birth registration process. Bangladesh government has started birth registration online since 2010, and at present there are 582 registered offices are doing online birth registration. National Action Plan to End Child Marriage 2018 to 2030 has been formulated to eliminate child marriage through existing institutional initiatives, programs, and combined efforts of all. The government has enacted the Child Marriage Restraint Act 2017 and made it rules in 2018 with an aim to reduce child marriage by keeping provision of punishment for the offenders. The hotline 109 service is aimed at receiving complaints against domestic violence, child marriage, sexual harassment, physical abuse, dowry, detention, child custody, and many other forms of violence and abuse against women and children. And another one is that incorporated mobile court into current CRMA 2017 to try the perpetrators of child marriage. Mobile court can punish the culprits on the spot, but it is less active in Cox's Bazar at present. Another thing is that we are doing work through BCT program and create some partnership with locally elected bodies, like-minded organizations who are working in child marriage issues and human trafficking and gender-based violence issues. And here is some UN cluster group and with some local NGOs and NGO like Save the Children, Plan International, UNICEF, UNFPA. And we have partnership with community radio, local community radio, that is NAV. And we have a partnership with service providers and Ministry of Women and Children Affairs. Some challenges we have faced to implement the program activities, especially in the COVID-19 pandemic. Delivery of service addressing CM trafficking and GBV has drastically changed in the pandemic. Safe spaces are closed during the lockdown. There was limited permission from local administration to continue the program activities, and mass gathering is not allowed to organize training, awareness camping in the pandemic through the authority. So it has not been possible to implement the activity as planned. And for this reason, child marriage and trafficking issues are raised. Another difficult issue was to use digital mode of intervention and to reach the maximum program participant of the remote area of Cox's Bazar due to lack of internet network facilities at the upajelas of Cox's Bazar. Because of limited electronic devices and limited knowledge on how to use electronic devices, especially women and girls. Some parents see marriage proposal as an opportunity to affluence the financial burden of COVID-19. So they are taking their child married to move another place in the camp. The special provision, Article 19 of the Child Marriage Restraint Act 2017 said that parents can arrange marriage of a girl under the Act of 18 under special circumstances. Suddenly, many people tried to take advantage of that provision in the host communities. And there is not enough entertainment and earning scope for men and women in the camp for Rohingya communities to engage them. That's why adolescent girls and boys are attracted to each other and feeling interest to do marry. In the Rohingya community, camp in church, actually the representative of the government have taken the initiative to reduce child marriage, but the parents are changing places and getting married in camp, and it is very difficult to find out them. And last of all, we have some recommendation based on our challenges and our experience. That is collective response is needed from all the stakeholders, members of local government, local administration, civil society organization, NGOs, other private sectors for a holistic process of effective planning, implementation, and monitoring to prevent increases in human trafficking and child marriage in the context of COVID-19. And a need to emphasize to use a low-cost technology and increased capacity of women and girls to use those technologies is needed to meet this gap in the pandemic. It is necessary to conduct comprehensive and cross-sectoral programming based on a proper assessment of preventing and protecting needs of women and girls during COVID-19 to ensure their rights, and need to engage youth through youth club and child club, need to organize awareness program more and more to sensitize community people, both the host community and the Rohingya community. And that's all from my side. Thank you.
Thank you so much, Preeti. This was a very comprehensive and excellent overview of the situation. I see we also have 2 questions for you for later. So I'm looking forward to hear even more on the prevention work that you're currently doing. For the last and final presentation, we are going to focus on Nepal. So we have Kapil Airel, who is the Executive Director of the Nepal Institute for Training. Oh, okay, now my notes disappeared, sorry. Institute for Training and Research, and also the Associate Professor at the Kathmandu School of Law. And he's gonna share with you about some recent development in Nepal's entertainment sector. Kapil, over to you.
Thank you, Julia. This research was conducted by PPR, and I was the lead researcher for PPR. And this study was about new and emerging trends of human trafficking in entertainment sectors in Nepal. There is no official recognition of the or the definition of the terminology adult entertainment sectors in Nepal, but this terminology is being used to refer cabin restaurants, massage parlors, dance bars, tiffin homes, and Nepali folk songs and music restaurants. And entertainment sectors are growing. These sectors, these types of venues are growing day by day in small towns and all cities in Nepal. And there was a study, a kind of survey conducted by Ministry of Women, Children and Social Welfare some years ago. And they estimated that around 30,000 to 40,000 female workers are employed in this sector. But the organizations working for these women and girls working in the entertainment sector say that there are more than 60,000, almost 100,000 women and girls are working in these sectors, and even children, girl childs below the age of 14 are working in this sector too. And there have been some studies on these sectors, and these studies suggest that there is forced labor and sexual exploitation, but there was not such a study which clearly said that there is human trafficking, and none of the studies pointed out what is the dimension or what is the trend. So we conducted this research, and we had out of 4 major objectives. One of the objectives was to identify emerging trend and dimension of people being trafficked in this sector, in these so-called entertainment sectors. And other objectives were to identify available services and mechanism for these survivors. What would be the livelihood options for these young people working in these sectors, and we also aim to provide necessary suggestion for amendment in the laws, regulations, or policies if needed. And we conducted this research on the basis of both primary and secondary data. We interviewed 26 key informants. They were expert or having good experience in Nepal about human trafficking and entertainment sectors. And we had 3 special focus group discussions, 1 consultative workshop with experts, and we conducted survey with the adult entertainment sector workers. We visited some major spots, which is known as having many entertainment sectors or these type of venues. And we went door to door in these sectors and surveyed with the workers. And we collected some case studies, we reviewed laws, and we also went through several secondary resources. And because of time limitation, I'm quickly going to share some of the findings. We found that almost all the respondents, the survey respondent, informed that they did not have consent. They had no consent to come to these work sectors or venues, and they were unknown of their work. Some of them said that they agreed to work, but they did not know what types of work they actually had to do in the sectors, and they had to do different work than they were promised. They were not paid, they were underpaid, or their payment was on holding. That means that they were given, they were paid in certain intervals, certain months, and they were not able to leave the job. They were controlled by threat. that was basically physical, emotional means, and sometimes their payment was on hold, so they were not uh, uh, living because all their payment was with the owner. So there were various means that they were being controlled by the owners, and the study also found that um, these girls were uneducated, they didn't have skill, so they wanted job anyhow, and it was very easy for the recruiters to recruit those girls, and they were also willing to provide jobs to these unskilled, uneducated girls because they could exploit. And they were also transferring or transporting girls from one venue to another, one district to another district. They were sending to various their chain restaurants and other places. And most common form of exploitation was the forced prostitution and labor exploitation. And the amazing thing that we found was that some of the girls were also happy with their situation. They had accepted the situation and they were planning to operate their own massage parlors or cabin restaurant when they grow up. That was amazing thing that we found in this study. The risk factor that make them vulnerable is the imbalanced power exercised in these sectors, in the work, this nature of job and this nature of business, because these girls, the women and girls, don't have education, they don't have skills, they are from poor economic background, and they have to earn for their families, and it's very difficult to get job when they are uneducated and they don't have skills, and they want job but they don't have education and skills, so they were agreeing to whatever situations they have to face. And none of the respondents in our surveys had gotten written job contract. None of them had written job contract and TOR, nothing at all, and payment was inadequate. They were most of them were getting payment on the basis of the client's bills. So if the client's bill is of 1,000 rupees, then they would get certain percentage from that bill. So that is how they were getting salary on the percentage basis, on the basis of client's bill or customer's bill. There are definitely certain services and mechanisms, but these services and mechanisms are not properly working, so that there are problems. For example, there is Ministry of Women, Children and Social Senior Citizen, Ministry of Labor and Employment, Social Security, Ministry of Home Affairs, Ministry of Foreign Affairs. If they are trafficked to India or to Gulf countries, there is Ministry of Home Affairs. There is Office of the Attorney General to prosecute offenders. There is everything. There are government agencies, and there are several committees at the federal level. That means the national level, National Committee on Controlling Human Trafficking, district committee, local committee is there, but these are not properly functioning. And there are several independent human rights monitoring watchdogs, human rights monitoring institutions like National Human Rights Commission, Women's Commission, and there is Nepal Police to investigate the crimes. There is Anti-Human Trafficking Bureau within Nepal Police, which is recently set up and which is doing good job to my knowledge. There are hundreds of civil societies working against human trafficking. There are loose networks of these organizations, and there are development partners like Windrug, USAID, and many other supportive hands. But the problem is human trafficking is still a problem, and to make these sectors a dignified workplace, there must be job contract. There should be guaranteed that they would get job contract with TOR, and minimum wage should be guaranteed, and there should be effective monitoring from these authoritative bodies that I just said in earlier slide. And this research was conducted before the pandemic situation in Nepal. Nepal first witnessed COVID patient in December, and the cases started rising, and government of Nepal announced nationwide lockdown from March, and it went straight up to 4 months. That means 4 months of complete closure of the country. none of the business sectors were open, especially hotels, restaurants, catering, and similar services and entertainment sectors. All these types of service sectors were completely closed for 4 months. And as I said earlier, that the people, especially girls and women working in these sectors, are basically not that much educated, and they don't have special skills where they can shift the job. But the problem was these sectors were completely closed and they had no job at all. Their employment was gone, um, and the problem was that they had to choose whatever they get. And uh, they some of them started working in the construction sector, some shifted to agriculture, some, and whatever they got, they started doing those such things. And I don't have evidence to say that some of them chose prostitution as the profession, but informally we understand that that was also happening, but I don't have any evidence to say that. And the benefit was to the traffickers. They targeted these financially vulnerable families and these women and girls who were vulnerable because of this unemployment, on education, and on skill, being on skill uh, people. So Anti-Human Trafficking Bureau rescued 41 trafficking victims from India and Nepal, 28 from India and 13 from Nepal. Even in this strict lockdown, none of the vehicles were in the street. There was strict lockdown, that vehicles were not permitted to ply in the road, uh, even private or public. So how these girls were taken to India, that is very interesting. And some of them were taken by the special pass holders. They made perhaps they made some special pass from to ply in the road permit. Maybe they used ambulances, or and the problem is Nepal and India has open border, and it's very easy to get into India from Nepal. Nobody needs a passport or visa. So it's like going from one district to another district. Uh, so that was the case, and it's very interesting that even in this strict lockdown, people were taken to India from Nepal, and luckily these 28 girls were rescued, and the internal trafficking was also on rise. And the problem that we are witnessing right now is that more than 80,000 people who were in labor migration in Gulf and many other countries, basically Malaysia and Gulf, they have returned to Nepal as as they lost the job in their place of destination, or many companies have been closed, or basically Nepalese are working in hospitality sectors, and these hospitality sectors are hardly hit all white, and these people have returned to Nepal. Now they don't have employment, they don't have education, they don't have, perhaps they learn something in the foreign land, but there is no head where they can get job. And businesses have are not fully operational for now, and there is still a threat that many more people would be trafficked to India and to other places. This is what I can share, but this was not within the report. That is what I recently did for other institution, and I know from other study. But the previous study shows that the study that I shared said that there is human trafficking on the basis of the definition of trafficking protocol. There is forced labor, there is forced prostitution, and there are many other elements that we can clearly say that there is human trafficking in Nepalese entertainment sector. Though this particular terminology is not official, as there is not such definition of adult entertainment sector, and nobody can get permit for running an adult entertainment sector in Nepal. So this is what I can share with you for now, and we'll discuss more when we go to discussion session.
Thank you so much.
Thank you. Yeah.
Thank you so much, Kapil. Because I got some questions about this, I think we will be able to share the PowerPoint presentations together with the recording for all of you as well. So you can also read up on the details that have been shared.
Sure.
We're now going to take some questions. I saw there's a few that came in for BT and also Blue Dragon already. Just as a reminder that you can still submit questions now, in particular for Kapil, that we will also take and address. I'm going to start with the first question for you, BT. That was the question on the top, and it's about your work with religious leaders to prevent child marriage. So the question is what you found that worked really well, and also what you found will be ongoing challenges of working with faith leaders in preventing child marriage.
Please repeat, Julia, please repeat this question.
No worries. You can also look at the question and answer panel. So it's about your work with religious leaders in preventing child marriage, what you found that worked really well, and what you think will be ongoing challenges of working with faith leaders in preventing child marriage.
Actually, we have shared to my presentation that the challenges is we face the challenges. Actually, Julia, can you write this question in chat box before facing problem in network? So
let me send it to you now.
Yeah.
Curious. Do you have it, Billy? Take your time.
Yep.
Okay.
Okay. Can you hear me?
Yes, we can hear you.
Okay. We are trained child religious leaders, especially in the Rohingya camp, because Rohingyas people are very much influenced by the religious leaders, and there is and they are very much respect to religious leaders. So we are giving the messages to the religious leaders through the different types of organizing different types of training on child marriage issues, and the Bangladeshi law, especially in Child Marriage Restraint Act and CIC camp in charge through the who are the representative of Bangladesh government and another organization. Commonly, we are giving the messages to the religious leader as they are living in now Bangladesh, so they have to follow the age for their marriage, and we cannot definitely they have to follow the Child Marriage Restraint Act, especially for the age of the marriage, and definitely it will be below 18. And another thing is that we are providing training, and we are giving them message, and we are sensitized the religious leader, and trying to motivate them when they are saying their prayers in the mosque, especially in Friday in their Jummah time. And maximum Muslim communities are living in the camp, so they can convey the messages of the child marriage issues, especially the age of the marriage. And we are finding challenges because really some religious leaders are convinced and some are very much biased on religious issues, and sometimes they do not motivate, and sometimes community people are not influenced or mobilization by them. That's all.
Thank you so much, PT.
Okay.
I think we can also share some contact information if
Okay.
anyone has follow-up questions for you.
Okay.
As well.
Okay.
All right.
Thank you. Thank you.
Okay, next one is for Blue Dragon. I'm gonna split this question. Luong There was one question, how do you determine whether your prevention efforts are having an impact? I'm gonna ask you, since we just talked about impact evaluation before this session, maybe you can on that.
Thank you, Julia. So yes, there's a lot of campaigns and raising awareness activities, not only in Vietnam, but all over the world about human trafficking. So how we can measure the effectiveness of those activities? So frankly speaking, at Blue Dragon, we do not talk about raising awareness activity. We talk about behavior change. We are not interested in mass campaign to reach a lot of people. However, the most vulnerable people, communities in Vietnam to human trafficking are people in mountainous area who cannot access with internet and the media to get information from that mass campaign. So that's a reason why Blue Dragon have developed our own model that we call early warning system. So in each commune, we will establish a groups of people got involved of own functional authorities. They are trained about human trafficking, how to make report, how to educate community peoples about human trafficking. And then monthly, the village leaders will visit own households in his village to talk about human trafficking, to share a case study, and to identify the high-risk cases. So it's not only about educate about human trafficking, but the main focus on identifies potential cases and then support them so that they are not being trafficked. For example, so when we first visit one village, we find out that there are 5 people missing from the village. No one knows where they are, just in China, that's all. So we support them to collect information and then make the report to the community level. And then we support them to work with the police at the district and the provincial level to investigate the case. And then we find out that not only 5 people from this village, but other 11 people from other communes. So we have the provincial police to work with Chinese authority, and then we rescue all 16 people come back to the community. So I think the most important thing to determine the prevention efforts effective or not is not about raising awareness, not about one-time education activity. That's a follow-up activity. Helps people change their ways when they go out to find a job, and then support them so that they see that who are victims, who are at risk, and how the community can help them and bring them back. Yeah.
Thank you, Luong. I think that's a really good point, in particular when you talked about the behavior change model versus just raising awareness. So thank you for expanding on that. I see there's also someone asking for your contact information to learn more. So we'll pass that on if okay with you.
Yeah.
Cool. Then Michael, for you, maybe you can speak more about your collaboration with the government. So there's a few questions about that, how you coordinate with government entities in rescue operations, in prosecution, and also reintegration, if you have any good practices in working collaboratively with them, and how supportive the government are, in particular when it comes to the sex tourism that brings money into the country.
Yeah, they're really, really good questions, and especially for the Vietnamese context. When Blue Dragon was very small, to be honest, we didn't have good collaboration with the government. We started out kind of on our own as the scrappy little NGO trying to solve all the world's problems, and we learned the hard way that actually to get anything done, we had to do that in conjunction with the government, and over the years we've gotten a lot better at that. First of all, we need to find the right government agencies and people within the government to work on the issues with us. We do work quite a lot with the Ministry of Public Security, so the police. You've also heard Luong mention the border guards. And maybe the first time that we work with them on it might be sort of on a case-by-case basis, and then we build that up to become more of a formal memorandum of understanding, for example, or a project together. We do find that getting high-level support is key. So starting to work with a province, for example, getting things signed off at provincial level. Because then in Vietnam, the way things work is that once the provincial government has agreed, that will filter down to the district level and to the commune level. Whereas if you just go straight into the commune level where the villages are, people will be maybe afraid to work with you because they don't really know who you are and they're not sure if their superiors have approved this activity. So we have to get that sign off from the high level, no matter which level of government we're working with. And we find then that things will go smoothly. A lot of it is about communication. And one thing we've seen in the Vietnamese context is that often government is uncertain how to work with foreign NGOs. From our point of view, we're here to help and we'll do what we can and we're bringing resources. From the government's point of view, we might be an unknown entity. And all our goodwill in the world, they don't really know our motivation until they've worked with us. So it takes time and being prepared to listen to the government, not just us being the experts telling the government what they should do or what they should know, but listening to them and not taking away the power. NGOs want to do things for credit. We want to have our name on those banners and we want to say what we've done. But if we take away from the government their ability to do that, then we're harming our own work in the long run. Does that answer the question? Is that a good rounded answer?
I think so. Thank you, Michael.
Thank you.
Thank you. I think that's very practical. And as you said, you really have this experience of building all these relationships. So I think that's really good insights you guys are sharing. We're gonna do one last question because we're almost out of time, but we have one more for Kapil. And this was about Kapil, are you there?
Yeah, I'm
yes,
listening.
Okay.
Yeah.
It's about your opinion. What might be viable livelihood options for the youth working in the entertainment industry in Nepal?
Yeah, thank you. We had that question in the survey questionnaire, and as most of the workers in these sectors were uneducated and unskilled, they didn't see the other options than working in the entertainment sectors. They had no idea that where they can go and what kind of job they can get outside. So they had known these people, they had known these places, and they had not seen any other workplace rather than working in the entertainment sectors. But what they suggested us is that if these work sectors are made dignified, and if they are paid well, they are happy to continue working in these sectors. And only few of the respondents suggested that they would establish their own entertainment venue when they grow up or when they earn some money. That was what they had their idea. They had in their mind. And Govindaji he questioned, and I had a written reply as well. There have been a number of programs that provided training to these women and girls for their livelihood. For example, handicraft or many other trainings for their livelihood options, but they were not earning as they were earning in the entertainment sectors by the tips or some other ways. They were earning more, and they were enjoying their life in or another way, as they said. Some of the respondents said, though there is exploitation, but they were not enjoying handicraft or other tedious jobs, tedious works, and it was very hard for them to earn money from other livelihood options that NGOs provided. So it is very difficult, and we have to accept that uh, we have tried many ways to withdraw these women and girls from the sectors, but after withdrawing and after providing livelihood trainings, they have returned back to the same sector in some months or in a year. That we have faced in Nepal. Thank you.
Thank you, Kapil. I wanted to say, if you have any questions we didn't get to today, or you think of any new questions, please don't hesitate to reach out to us. We're gonna also be able to put you in touch with the presenters today, and I'm sure they will be happy to expand more on specific issues and questions you're interested in. We will also publish a recording of this webinar on the Freedom Collaborative website later today, and we'll send, as usual, a follow-up email and also include the presentations that were shown during the session. Yeah, that leaves only to thank all the presenters. Thank you, BT and Kapil, Michael, and Luong. And thank you to everyone for attending the session today. On behalf of Freedom Collaborative and USAID Asia CTIP, thank you for joining us, and we wish you a great rest of your day. Thank you.
Thank you.
Thank you.
Okay.
Thank you.
Bye, everyone.
Bye.
Bye.
Yeah.
Bye.
Bye. Bye, everyone.